I want you to tell the YouTube about your last day.
Oh, my day yesterday. I went to Nashville to visit the lady for Valentine's Day, trying to be a nice guy. Yeah, I go to make the trip back. My incredibly reliable car.
The Hyundai.
The Hyundai. Besides that, it wants to make some wild noises on the way home. Yeah, I get stranded in between Nashville and Memphis. Get stuck for an hour, miss my lab. Finally get a car to drive back to Memphis. You know, I'm mentally exhausted, stressed out. So I stop to get a nice cup of Joe. Try to improve my day a little bit.
Pick me up.
Yeah, a little pick me up. In the parking lot, set my cup of coffee right up there on top of the roof. And as I go to open the door, the coffee goes right off the roof. Does 2 full 360 spins. I get a nice line of coffee from my head to my waist. And I just stared into my eyes in the reflection of the window and just contemplated whether or not I just wanted to drive my SUV off the interstate. Yeah, but then we got back and now everything's great. I'm having a great day.
Yeah, life is good.
Life is good now. You know, I just had to have my one day and now it's only up from here.
Find the positivity. That's the message for today. Find it.
Into the black hole. Sing for my soul. Through the black hole. To make myself whole.
So if you have lost one bypass bit, you do a bridge like that. Basically the length according to this formula that you see on the top right.
What's up, guys? You know the deal. My name is Steven. I'm a second-year dental student, and I am vlogging the day today in dental school. We are starting out with fixed prosthodontics lab, and I am still working through basically my Pendex project, which is our major project for the semester. And we have all of this going on. Today I'm going to be segmenting this cast, so I'm going to be cutting lines through the cast so that I can remove the teeth, basically. I'll show you in the process as I do it. But yeah, hopefully you enjoy this video. Let's get into it. How does Lane look, everybody? New teeth. Congenitally missing.
7 and 10, my laterals.
7 and 10.
Yeah.
Going through implants.
I got my implant procedure done here at the school.
Yep.
The graduate prosthodontic department.
Shouts out to Dr. Moore.
Shout out Dr. Moore. She's the GOAT.
Yep.
Dr. Broding placed the implants.
Okay,
He graduated. Dr. Moore
Okay.
is in charge of the process now, and she made my new temporaries.
Right.
And your boy here, the man holding the camera, was the one who matched the shades for me.
I think it looks good.
I think it looks great.
I think it looks
you did a great job. Man.
I acted like I actually did the work. You're so cute, dude.
Situations.
You're so cute. We're doing a handshake here. Let's do this.
You can do it slow.
Okay, let's do it slow. That wasn't bad.
I think that was the problem.
One day we'll get the
Dude, that was pretty good. That was pretty close. That was pretty close.
You had a rigid thing that was hard to snap.
They ask you how you are, you just have to say that you're fine when you're not really fine.
Dude, and you're way too deep. It's a tip.
I got long fingers.
No. You see how tight that was? Look, see?
So let me explain this a little better. So this right here is my pretty boy swag now. This right here is my mandibular cast with 3 crown preparations on it. Basically, we're kind of simulating a removable partial denture in this process. And so I am at kind of like past the pendexing stage. So basically I've mounted this and there's little pins. So there's little pins in these segments and those stick into these holes. All you have to do is section the cast. So, disaster has struck here. Basically, in this process of trying to section off this tiny little premolar, I ruined my entire project, which means I have to do all of this over again, which is like 3 days of lab work, maybe. So this is what happens. This is dental school. You guys are interested in going, maybe you should reconsider. Oh, this sucks. This really is just part of it. Things don't always work out. And, you know, it's part of it.
Oh, that
Look at this.
sucks. That's what you get for making fun of me every day.
Yeah, that's what it is. Yeah, that's
Exactly
my.
what it is.
I literally have to start from the beginning. I have to start by pouring out my impression from the very beginning.
Did it break them? The sawing? Everybody's...
It broke on this part. It broke on like the little.
When you're
sectioning it and getting the pen out.
Everybody's breaking on their sectioning, so I don't... That's all.
So I've actually gone ahead and poured up a new impression here to start this entire process over again. But I think I'm actually going to try and salvage this just because why not? But this is part of it. This is how dental school goes. Things don't work sometimes, and you either have to just start over or try to salvage it, but it's a learning process. I'm not too upset. I'm a little upset, but I am gonna try to fix this. Basically, I'm gonna take this right here, glue these pins back in, and try to add a little bit more stone onto this. Just try to salvage this whole thing. And I don't know if that's gonna work, so while this cast dries, I'm gonna try to fix this. So here's a little update. First off, I've made a massive mess here, but this is the little segment that I attempted to fix, do some surgery on and fix, and that'll go in right here. And the rest of it, I'm just gonna keep going along with the project. I did pour up another cast here, which I'm hoping I don't have to use, because that would mean I'd have to do all of this over again. But basically now I'm gonna be doing this, so drawing out the margin and then trimming the stone around like that. Stop looking at me.
Very smart. You're recording yourself doing this, so you always remember. Good for you.
I showed myself messing this whole thing up. That's what I did.
Cross my name off the list. This is without rhyme or reason. I'm not an optimist. I just never dress for the season.
Okay, so this is the final look at today's project. I basically tried to salvage this thing, and as you can see, that's not correct. It's supposed to look like this. So you can see how there's space between the crown that's prepped and then the two adjacent teeth. This one right here is what I actually tried to fix, and you can see that the path of draw is not correct. It's sitting a little bit too close to the adjacent tooth, so I'm probably gonna have to try to do this again, but basically everything else is on the way, and I think that I'll be able to salvage this. Just kind of sucks.
Be still and run the race. Be still and run the race. Be still and run the race.
So that lab was just a comedy of errors, but I'm actually kind of glad that that all happened. I think it's gonna make the video a little bit more realistic. Dental school is not always fun and games. Everything that we do basically is, in theory, pretty simple, but when you actually start to get it done in practice, it can be very difficult and things can go wrong quickly. I feel like most of my vlogs, I kind of show what I'm doing and everything goes well. In this case, what I was trying to do all failed immediately. And I'm, once again, just kind of glad I could show you that process and then show you how I attempted to fix it. The project is far from perfect, and I'm gonna have to go back and probably do that fix again to try to get the path of draw correct on that tooth. But I do think I'm gonna be able to salvage the whole thing instead of having to go back and start completely 100% over. So it's time for lunch. I'm heading to Subway with my buddy Dylan, and there's probably gonna be a bunch of people from our class over there. And then after lunch, we will be heading to the clinic to assist the 3rd and 4th year dental students as they take care of patients, which I've never showed you before. I'm not sure how much of that I'll actually be able to show you, but I'm gonna try to get as much as I possibly can. So to lunch it is.
I'm about to cross. If I get hit, I get hit. I mean, I don't have to do
Say that again.
No, I want to be a dentist. I'm joking.
What you gonna get? Probably a 6-inch rotisserie style chicken. Ooh. Like Italian herbs and cheese. Sounds ooh. just got out of the clinic and I have plenty to tell you about. So let me take you to one of my favorite spots and we will talk about this entire day. Here we are, baby. This is like my favorite place to come, especially when it's nice out. My hair is gonna look absolutely insane, especially up here in the wind. Basically, I wear a surgical cap most days because I have longer hair that's really straight and thin, so it doesn't really do what I want it to do. So when I take it off, it looks like it looks. But it's a beautiful day. It's like 67 degrees out here, and I wanted to give you a bit of a recap in my favorite spot, but let me show you the view first. So yeah, this is the parking garage on top of my apartment complex. Let me talk about what happened today in clinic. So this was an intro to clinic course. This is basically the course that is allowing us D2s to get into the clinic for the first time and to start participating in some of the things that are going on there. Gosh, it is windy. So with the intro to clinic course, we as D2s are getting our first chance to go into the clinic and assist 3rd and 4th year dental students in all of the different specialties of dentistry. So today I was working with my buddy Colin. Colin is a D4 student here. He's about to graduate in a few months, and he was working on the master impression process for a removable partial denture. The cool thing about this patient is that this patient retained 7 lower crowns, and that was the only crowns that they had left. And he used spots on those lower 7 crowns as rest seats to go ahead and start the fabrication of a removable partial denture. So I worked with him today, and we went through the process of just basically taking the master impressions. This was great because learning impressions, something I've talked about on this channel very recently, is very important for every dental student. We want to get really good impressions, especially for something like this, where the impression in that first master cast is absolutely key to the fitment of the partial denture. So basically he surveyed the cast after he poured it up, which means he drew a bunch of lines on it to help with the design of the RPD, and he's gonna send that to the lab, and in 2 weeks he will have a framework back to try in on the patient. Just getting into the clinic for the first time and understanding a little bit about how it works and what our role as students there is, it's just invaluable, and I've really enjoyed being able to go in there and meet some of the older students and just hear the things that they've learned over their past, year or two in the clinic. It is just great stuff. So I'm gonna wrap the video up right here. I hope you enjoyed this vlog. I hope I was able to show you some good stuff. Takeaways from today. Number 1, dental school is not always a string of successes. In fact, it's quite the opposite at times. This morning, I thought I was going in to do something very simple. I thought I was gonna section up my cast and then start waxing the crowns, and I failed miserably, messed up my cast, thought I was gonna have to start over, still think I might have to start over if I can't get the thing fixed. So there was a complete learning experience there, and I'm super happy I was able to show you that. And then I was able to get into the clinic and learn some things about the master impression process and just more about RPDs in general. D2 year, it's like this big transition between 100% being in lab and lecture to being mostly in the clinic. We're kind of being stretched in multiple directions right now. So it's very enjoyable, but it's a lot. Once again, hope you enjoyed this video. If you want to see more vlogs like this, me just bringing the camera around and doing it like this, let me know in the comments. I do enjoy doing this, and I'm getting a little bit more comfortable in certain places with the filming. Also, shout out to Jack Hahn for the inspiration to start filming more. You are a beast, man, and I look up to you in a lot of ways, so keep doing what you're doing, buddy. For all of the rest of you, thank you so much for watching. Remember to subscribe if you want to see more, like the video, and comment what you think down below. I'll see you guys in the next one.